think of our wound dressing. How the wound dressing would be only just to put, I was discussing with you, how to put the bag, right? For those wound dressing, I showed you the bag that we need to change. Only this is the difference. But the cleaning procedure, process itself, the same with wound care. Okay? So now, what we are going to do now is so we will do our wound dressing, simple wound dressing. So we want to know what is a wound, what does wound dressing means, what are the kinds of wounds, why we are going to do the wound dressing, and what else? What are the procedure? Okay, in the wound dressing that we will be doing, this one will include all. Wound dressing, that's tracheostomy. Colostomy care and the peg care. Okay? Because as I told you, only one technique we are going to do. Okay. So what is a wound?
It's a cut or broken skin. It's a cut or
Any opening of the skin.
Any opening of the skin, within the skin. So it might be a cut, it might be abrasion, it might be lesion, or incision, or amputation, whatever there is a cut. Okay, that is a wound. And the wound dressing is, another word for a dressing is cleaning. But in a medical term or in the healthcare facility, we are not saying it as cleaning, wound cleaning, no. So we are using the word wound dressing. I want to dress your wound. Okay? So why we wanted to do it or why we are going to do it? So number one is to provide good healing, wound healing, good wound healing. Second is to definitely we will prevent further infection. Next is to provide patient comfort because once the wound is clean, so they will be like feeling comfortable. Now, what we need to use or what equipment do we need to use? So we have a dressing kit which is sterile, and once it is sterile means to say it is 100% bacteria free. So once you get it from your supply department, it must not be any tear, any broken opening, or anything that will cause the damage to the dressing kit. Okay? Because any opening will compromise patient infection. Okay? So now, we have dressing kit. Check your, the contents of this are all inside of this wound dressing kit. We have the expiry date. We need to check the expiry date. Okay? So once it is expired, no need for you to open. Return it back to the supply department. So there is no tutu. There are pictograms. We call it pictograms. This pictogram says no tutu. Means do not use it for the second time. Only one-time use. Okay? Anything that you did not use, you open. You did not use the gauze. You did not use like this. You do not use it anymore. Okay? For the gauze, you wanted to clean this. Okay, fine. Okay? But you do not use it for your patient. So we need betadine solution and a saline solution. These two solutions are antiseptic solution. Means to say, it helps to sustain or it helps to clean, to prevent infection. So opening this, all sterile pack should be opened only in this kind of thing. Okay? Open on top, take out what is inside. The pack should be set aside. When opening, you have to, wait a minute. Okay, so opening of this, we have to hold the tip. There is a tip, or we call it a tongue. Okay, a tip here, open. So do not hold here. You will compromise the infection from inside or the sterility. Out, out, and out. Okay, so all of this area inside of this is sterile. So never touch whatever is there with your unsterile hand. Lift, okay, palm up, insert, okay, fix it from under, up to your wrist, scoop, palm up, insert. You can fix it now from here because both are sterile now. Take out the yellow waste bag. There is adhesive here. You can just stick it on the side of the rail, okay, like that, or keep it on the side. Now, take this out. This is disposable dressing pan. So the underneath is a plastic and here is the absorbent one. So let the patient, Baba, I will just put my pad under it. Okay, so the pad is already there in place. Now, since I'm sterile, if I'm alone, so I will just do for myself. If there is someone like anywhere there, just call them, please help me. So you are not going to change your blood. Okay? So once I'm sterile now, I will just be going to continue holding this unsterile thing. Okay? So I will pour betadine here, keep it a little high. Saline solution here, a little higher. And I will change my gloves. Okay, assuming I change my sterile glove, so I will proceed. Take out, this is our dressing towel. Same way with the dressing towel, we have the absorbent and we have the plastic under. So it should be, there should not be any cut. So it depends on the patient's wound. If it is this long, cut this long. If this is so small, so cut this small only. Okay, so it depends. So put it this way. Okay, keep other things out. On the field, this is a sterile field, so keep it aside. We have, this is disposable thumb forceps. Thumb forceps, you can use this while doing your dressing if you are comfortable. But if not, because sometimes this one will slip. Okay? You are not that comfortable, better use your glove. So this is non-top, non-tooth. There is no tooth here. So if there is a tooth, maybe better because it will hold. Okay? Set it aside. Okay, now, we will start with our dressing. Take the betadine, the cotton with the betadine, in. In, hold your hand here. Huh? In. So, circular until you cover all the space. Out, receptacle. Next, in, circular to cover all the space. Out, receptacle. We'll go with saline. In, same way, cover all the space, do not go back. Okay? Even for your swabbing, anything, you just go with the circular. Out. Okay? Never, never come back or do like this. Okay? In, circular, to the surface, out. In, circular, surface, out. Now, let's dry it. We'll get a gauze, fold it into 4, pat, tap, 1, 2, 3, tap, 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 receptacle, again, fold, tap, in the middle, tap, 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 to the whole area, out, receptacle. Now, so we are done, we will just be removing this. Keep it inside, in the middle of this field. Okay? If you are comfortable to plaster, to put the adhesive, you are okay with that, you can do it. But, I'm not comfortable either because, anyway, the patient is okay. Patient is not infected. So, I will just take off my glove, clasp it, so, hold it this way to the receptacle. Get your adhesive plaster, or we call it the bigger size of, bigger version of your Band-Aid. Okay? So, anything you have to open on top. Okay? So, let it fall. Okay, in the middle, put this here. You will find here, just like the bigger version of your Band-Aid, you have the smaller side. Okay, to the left, smaller side. You do not hold anything from in because that is sterile. Sorry. So the smaller side will be on your right. Here, on your left, the shorter one, the longer one. So keep it. Okay, apply a pressure here or just stick it. 2 fingers slide down both sides. Do not touch in the middle. It might hurt your patient. So fix it. Take off. Okay, all of this gather together and will be, I'm sorry, oh yeah, good enough. So once we are done, so take off the dressing pad together inside of this. Okay, with your pack, keep it all inside of your yellow bag. Overuse.
Nanginginang kapalit mo.
Kuha muna ako. Okay, so there is a seal here. You can seal it. Or if there is, actually it comes with a wire. So with the wire, tie it with the wire and go with, dispose it to the medical waste. Come back to the patient, hand hygiene, hand washing, hand sanitizing. Come back to the patient, keep the patient comfortable, and document. Document date, time, whatever you have seen in the wound. Wound is full of bleeding, wound is full of pus, not healing well, not good healing condition. All of this, you need to document. Okay? So that's it. So we are done too. This dressing is enough the same way we are going to do our peg care. Can I have my telephone? Plus the water, please. Can you? Okay. I will show you a peg care. A peg. You have seen the peg? Percutaneous endoscopic gastrostomy or gastrotomy means to say that there is the feeding tube is inserted by the skin on the abdomen directly to the stomach. So that is the peg. Instead of giving your feeding by the NGT, you are giving by the peg. This peg is being given because the patient, though there is an NGT, patient continue to vomit. Okay? Not tolerating even with NGT. So doctor will just advise the patient to have peg tube. Peg tube is already something like permanent or longer. NGT is sometimes temporary only. Okay? Once the patient already is about to eat, so that NGT will be out. But those patients, elderly one, comatose or needs longer rehabilitation with the peg. So peg tube, we need to care like the way we do with the dressing. So peg care, there must be like a tube. Okay? This tube is supposed to be here, on this side of the abdomen, anywhere here. So this tube has two. This one has two tubes here. One for the feeding, one for the medicine. Okay? So there are two ports we are calling. Okay? So open the other side, that is for your here. Same way. So to put it here, same way. Get a gauze and pinch open, then connect, then same way with your NGT feeding. Okay? So flush before you feed, before and after. So the same way, pinch open. So wrap this with your gauze and feed. Same way with the medicine. When giving medication, water, medicine, water. Same. Okay? So once it is here, now what we need to do, same. In dressing, it will be circular. Tracheostomy is circular, right? So surrounding the tube. On the skin. Okay? On the skin. You have to be on the skin, surrounding circular, and out. Same. Second, betadine. Surrounding circular, out. Then saline. Saline, in, out. Dry, in, out. That's all. Same.
Are we also going to use the dressing towel?
Huh?
Are we also going to use the dressing towel?
I did not get
Dressing
that.
towel.
The dressing towel, no need to use. There is nothing. Only for your cotton balls. Okay? Cotton balls, draw gauze. Okay? That's all. There is no patch. There is no adhesive.
Ma'am, only one circular motion.
Only circular. Anything you do, circular. You do not circular, back.
Yeah.
No. One movement, circular out. Okay? doctors, nurses, and your interviewers are very careful with that. Once they see your movement doing like that, you're out. Okay? So you do not compromise your patient with your movements. Circular. Injection with that insulin, circular. Circular. Everything is circular, out. You do not go back and forth. Okay? So this is the peg. Now, with colostomy, I did not show you the peg and colostomy. I'll show you. Colostomy care. Colostomy, we have a colon. A piece of small intestine is out. Instead of your peg, this is a colon because your rectum is closed. So you are going to poo-poo here, not here. Okay? Because this is closed now. Means to say it's not being used temporarily. But those patients with the cancer colon, with blah, 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 that is permanent. Okay? So they are, because you should not use your rectum. So we are going to use this. So this, when there is obstruction inside your bowel, obstruction within your intestine, so they are being cut, closed, and you will be having poo-poo here. Until that one is going to be healed. Okay? But it will be longer time. So this colostomy is a piece of your intestine, which is out. If it is pink, means fresh, good-looking intestine. If it is already pale, just like, pale is no good. So you should see if it is pinkish, means that is a good colon. But if small intestine, but if it is already pale and there is not healthy, okay? Pink is healthy, that other side is no. Okay? So what we need to do, same. Get your betadine. So there is like this wound, it depends on how big that colon is out. So first, if there is poo-poo here, get a gauze. Even if it is moist or a dry gauze, clean. Okay? You know how to clean, right? Clean. Clean it. Okay? What? Imagine that. I cannot imagine how you will be when you see exactly what I'm talking about, So, this is a piece of, you do not be afraid if that is a piece. Sometimes this one is going in. Okay? When that goes in, you pull it a little bit. Okay? Pull it a little bit. Okay? Out. Because once it's go out and it's deeper, so it needs another surgery. Okay? So, it will be out, and that hole is enough for that colon to go out. Okay? So, once it is already long time, it is going in, so put it a little bit out. So, if there is poo-poo, okay, you will change. First is poo-poo. Clean the poo-poo. Okay? Clean out. Again, clean out. Not with betadine. I said only just clean with the dry or a wet one. Okay? Moist. So, clean, clean, clean. And then, saline. Better saline. So, clean, 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 clean already. Okay? No betadine. Only clean. Now, there is surrounding. Same. This surrounding, we need to clean with betadine. Betadine, same. Betadine, surrounding out. Again, betadine, surrounding out. Again, saline. Out. Saline. Out. Dry. Here, this time, here should be very, very, very dry. Because if always this one leaks, you know, the poo-poo here, even with the bag, it always leaks. Not unless it is good skin. If the skin is already like red, there is irritation of the skin, it's difficult to put the pads. There is a pad. Okay? It will not stick anymore. So it's very difficult. So every time it will just leak. Okay? Even if you put, I will just show you, with that pad, square pad, you will put on the skin. It will come out this colostomy. The stoma, we are calling stoma. Okay? Once this stoma is out, we will put, this pad is like your ziplock. You know the ziplock in your bags, in your sandwich bags?
Yes.
Okay. So there is a bag, colostomy bag. So you have to stick it tight to that, like closing the, what do you call that one? The tie. Okay?
May adhesive siya.
Yung mismo, ang adhesive is under the pan. So, the one that I'm talking to you now is the colostomy bag. There is no adhesive, only just like ziplock.
Yung top bibig
So, zip it lang.
press it, yeah.
Press
Yeah,
it
press.
only. Okay? So, there are two kinds of colostomy bag. One, colostomy bag that is disposable. Automatically, when there is poo-poo inside, especially your patient is adult with a big impacted stool. Okay? It's heavy. Okay? That, take it out, throw it to the medical waste, or if there is no medical waste at home, throw it there, but need to be put in a plastic bag. If good for the patient, there is a colostomy, disposable, fine, throwing only. Okay? But if the colostomy bag, there is like a zip down here that needs to be thrown to the toilet bowl, clean that one, and put it back.
Better na disposable.
Yeah, it's not this one.
I told you, this is not disposable. You need to wash it. Okay? Wash it, clean it, the same as you are putting your poo-poo there. Okay? Flush it, and clean it, and dry, put it back. Okay? That's why I did not work in adult. Okay?
Need more gloves.
Because the first time I was orientation, after my license. During nursing, in the program, if you are new, you will be orienting the whole hospital for at least a month or two. You will be going all around because at any time, you will be pulled out. Okay? You don't have patient in that unit, you will be taken to another unit. Okay? So this is the thing, the purpose. So during my time, I was there with the male surgical. So that full. So first time, so I said, from now on, I will not work with adult. Okay, so I went with pediatrics, even adult pediatric, like 16, 18, below 18 is pediatrics. Okay, so below 18, even that adult, at least it's not that.
Pagka sa maanggo, maanggo.
Yes, I said, okay, I will leave you. I don't want that. So that made me a decision. I don't want adult. I never went to adult. Okay? So I was only in pediatrics all my life. Okay? So, but when during my supervisory, so you are going everywhere. So you will see all of these people. But not caring with them. Because you are just in the management. Okay? So that's it. I'm going to show you. You got my, the idea. You have that imagination.
Yeah.
What I'm talking about.
Better to show us.
Okay, I will just show you first the pen. Okay, so this is the ped care. Now you are still wanting to be medical, part of the medical.
Not the caregiver.
Caregiver is worse.
Yes.
A caregiver is worse because you are going to iron. You are going to, it's all. It's not the same. You are under a nurse. Remember, you are under a nursing law. So you are only under the umbrella of nurses. Okay? You are only being like a part of the home care because they are hiring you as a home care. Okay? As a caregiver in the home care. But if the company that you are going to be in will inform them that this is the nursing aid, only this is scope, only this is scope. Okay? Only this is scope of work. No ironing, no cleaning of like this, no marketing, no whatever, no laundry. Okay? Caregiver is kadama in a real world. Okay? So that is your two differences. You are only, if you can work, you will work under medical services. Assistance, anywhere. Assistance in the healthcare clinics, any dental, anywhere. Assistance. Okay? So I will be just showing you, this is Can you see the pen?
Yes.
Okay, so there are two like this. Okay? So there is a peg. This is where you are going to clean only. Okay? Keep it clean. Okay? Only that part are surrounding the tube. Okay? But with the tube itself, just clean with the normal saline. Okay? The tube itself, if it is dirty, just wipe it with the not the antibacterial, huh? So only the saline. Okay? So there are two openings. One for the medicine and one for your feeding.
Ma'am, alin dyan yung medicine yung sa baba, sa taas?
Ito yon. Ayan o. Siguro dito, sa maliit.
Maliit, yung po yung medicine, yung pagkain yung
Ito
mahaba po.
siguro, doon sa tube natin. Okay?
Tapos pag hindi ginagamit,
Naka-close lang siya. Ayan o. Meron siya dapat clip. Naka-clip yun eh. Naka-clip. Hindi ko makita yung clip. There is a clip somewhere here. Parang clip lang siya. Ere. Ayan. So, if you are not going to use your peg, there is a clip. Means to say it's closed.
Kalak na siya.
Okay? So, there is a clip. Yan o.
Ay, ganun yung trip.
This is what first.
Clip. So that it will not go through. I mean, it will not flow.
Parang ang
You
sakit
are not
niya.
using, right? So the same, it is closed, but they put a clip. So there is a clip. Okay, now, so there is a clip, only that, you see, once it is dirty, it is, it is already infected, it will become red. So be careful to keep it clean and dry always. Because once it starts to be pinkish, reddish, surrounding any wound, means going to be infected soon.
Ma'am, Yung ganyan po, nakalaylay lang po yan talaga or naka-tape yan sa gilid.
Wala naman. It will not be English, please. So they are asking whether it is just on that, like
Just only
that.
like that.
Yeah,
Keep it
it
like
is
this.
like that. If you want, you put a tape. Doesn't matter.
Maybe it's depend on the
Okay?
patient.
It depends on you
Comfortable.
how you will be doing good care to your patient. Now, let's go with the colostomy. So, this colostomy, okay, so that you will have your idea.
Parang pit ng manok. Nakikita ko eh. Nakabural na gano'n.
Okay. As I said, colostomy, where are you? So, if you can see this, it will be like that. Okay? So, it will be out of the skin. Okay? Anywhere along that colon. It could be here, but mostly to here. Okay? Anywhere, which part is affected. Okay? If there is something in between, there is a blockage in your intestine, so they will cut, they will connect, and they will open here. Okay? Isa-isa lang. Only one. These are the only sites.
The sides, ma'am.
Okay? Only side, but mostly here.
Mostly in the left,
Right.
right.
Okay? So here, always here. So this is, you are going to see like this. Now, the colostomy care. The colostomy bag. Your colostomy bag is like this. There is a clip down. Means to say, this is going to be reusable. This is the one with inside, you have to throw it, wash it, put it back again. Okay?
You need just to stick.
Just like your, what is that, closing something? Just like a zip bag? Okay. Now, this is it. This is where you are going to cut according to the size of your stomach. So, you have to cut that part and stick it here. And here, over there, you have to snap. Okay? You have to snap to press to keep it together. Another one, the disposable one that I'm talking to you about,
Ma'am, they remove this thing to clean it or what?
you will remove. I told you, take out the bag. Once it is full, the plastic is full. The bag is full. Take it out. Once you take out, clean, or you put your gauze here, and then throw that one, come back here, clean. And that's it, okay? Where is the one without? The one with disposable. Disposable colostomy bag is better. There are colors also. You know? So different colors of colostomy bags. Disposable. Okay? So there is a piece of that when you clean the under the skin. So this is a pad. There is a pad. You are going to lay it out under, okay, or just outside of this stomach. Okay? It is here. So this is what I'm talking to you as in like zip bag. So over here, you attach that colostomy bag. They will teach you there. They will tell you how to use it. Okay? So this is it.
magkiklik na siya. Parang siya yung cup ng nung sa kapihan. Ito yung sa
Okay.
coffee, coffee, cup of the
So
coffee.
this is it. You have to snap it. If it is not, if you are wrongly, if you did it wrongly, so it will leak. Okay? And again, it will leak under. So the whole thing, you will again clean and clean and clean. Okay? So these are the things like that. You have to put it here. Colostomy bag. Why I cannot have it? Here. You see, there is no down of this. So it is round, right? So that means to say there is no clip. So this is it. Take it out, throw it. Okay? But it happens that you have that down part, there is a clip. So that is reusable. Okay? So it depends. Okay? This one is round. Means to say, it is closed, right? So with that closed, you are going to throw it. Oh my God, 168. You are just throwing the 168. So this is the one with the clip. Okay? The one with the clip.
Ma'am, you will change that or clean that once a day like that?
Not once a day.
It's
As
dependent.
soon as
Yeah.
you see that it is full,
Change. Huwag mo nang pakainin si patient nung hindi magpupo.
you do not wait. Okay? So, if your patient is having diarrhea, that is worse.
Yes.
Because it is wet and it will leak.
And once you clean again,
You have to clean again. That causes the skin is irritated and you will get all of this something. Okay? So, one time, simple wound dressing, your peg care, and your colostomy care.